September 26th, World Environment Health Day. Theme for Day Campaign 2024. Creating Resilient Communities Through Disaster Risk Reduction. And Climate Change Mitigation and Adaptation. September 26th, World Environment Health Day. History of World Environment Health Day. The history of World Environment Health Day can be traced back to 2011, when the International Federation of Environmental Health, IFEH, established the day. This day was designated to promote the message of caring for environmental health for the welfare of the planet as well as of mankind. The IFEH dedicatedly leads World Environmental Health Day celebrations every year by assigning a new theme for the annual celebration. The IFEH also has member states that observe World Environment Health Day and organize various events to mark the day and spread the message. One of the main aims of this day is to help the globe meet the United Nations Sustainable Development Goals. Theme for the 2024 World Environmental Health Day. Every year, the IAGF sets a unique theme for World Environment Health Day. The themes are always set, keeping the ultimate goal of meeting the United Nations Sustainable Development Goals in mind. With a preset theme, the celebration of this day becomes aligned in different parts of the world. Creating resilient communities through disaster risk reduction and climate change mitigation and adaptation. Background for the 2024 World Environmental Health Day theme. Climate change and disaster risks are fundamental threats to sustainable development, human health, and poverty reduction. The increasing frequency and severity of environmental hazards pose significant risks to development gains achieved over decades. To build resilient and sustainable communities, it is essential to address both climate change and disaster risks comprehensively. This approach involves integrating these risks into development planning and budgeting, with a focus on both mitigation and adaptation strategies. Key points: interconnected threats. Climate change and disaster risks are interconnected challenges that impact sustainable development and human health. These risks can undermine progress and roll back development achievements, making resilience building critical. 2. Importance of environmental health. Environmental health professionals play a central role in addressing these challenges. Their work spans various domains, including infectious disease outbreaks, managing diseases exacerbated by environmental changes, air pollution, reducing pollution to mitigate health impacts, waterborne diseases, ensuring safe water supplies and sanitation, food safety and security, addressing risks to food systems, waste management, handling waste to prevent environmental and health hazards, emergency preparedness, designing and implementing disaster response plans. 3. Social and economic factors. Vulnerability to climate change and disaster risks is influenced by social, cultural, economic, and political factors. Addressing multidimensional inequalities and marginalization is crucial for effective resilience building. 4. Integrated approach. Building resilient communities requires an integrated approach that combines disaster risk reduction, DRR, with climate change mitigation and adaptation. The response includes mitigation, reducing greenhouse gas emissions to limit climate change. Adaptation, adjusting practices and infrastructure to cope with existing and anticipated climate impacts. Disaster risk reduction, implementing strategies to prevent or minimize the impact of disasters. 5. Key climate change impacts: cyclones, increased frequency and intensity of severe storms, drought, rising risk of extreme drought affecting large populations, floods, more intense precipitation leading to higher flood risks, heat waves, greater frequency and severity of heat stress affecting billions. Infectious diseases, expansion of diseases like malaria to new regions. Sea level rise, threats to coastal areas and economic assets. Wildfires, longer fire seasons exacerbated by changing conditions. 6. Policy frameworks and initiatives. Sendai Framework for Disaster Risk Reduction provides a comprehensive approach to managing disaster risks. Paris Agreement focuses on climate change mitigation and adaptation. 2030 Agenda for Sustainable Development integrates disaster risk reduction and climate action into broader development goals. UNDRR's Comprehensive Disaster and Climate Risk Management promotes coordinated efforts to manage disaster and climate risks. 7. Call to Action. The International Federation of Environmental Health, IFEH, encourages member organizations and related institutions to participate in World Environmental Health Day 2024 by initiating projects, develop initiatives focused on environmental health, disaster risk reduction, and climate change adaptation. Sharing information, informing IFEH about activities and sharing outcomes to enhance collective knowledge and action. World Environmental Health Day 2024 provides an opportunity to emphasize the critical role of environmental health in building resilient and sustainable communities. By addressing disaster risks and climate change through a concerted, holistic approach, we can foster sustainable development and enhance our ability to manage and adapt to environmental challenges. Thank you.